Good evening. As you read earlier today or this afternoon in my email, there's certainly a lot going on, and I know that you're hungry for current information, and I know that there's a lot of questions that are on your mind. This coronavirus, or COVID-19 as it's referred to, is this very quickly evolving situation, and for us, in many ways, it's a learning experience as well. What I'm going to try and do over the next several minutes and probably several videos is respond to you and try and provide answers to the questions that you're asking and questions that we've been asking, trying to wrestle to the ground. Now, I use this video method so that you're hearing directly from me. Everybody gets the same message. But I don't try to edit these. So I do have some notes I'm going to work from. I've got some handouts that I'm going to refer to that I will later email out to you. But what I'll likely do is if I get to a point and make a mistake, I'm just going to tell you, oops, that was a mistake. Or just cut the video off and start a new one. So you might get several of these before the night's over. At the very end, what I'm going to do is send you an email, and I'll identify definitively how many videos you're looking for. With each of these, we'll label them so that you know where we're at. So this one is COVID-19. It's video number 1. Today is March the 19th. And what I'm going to try and do over these videos is answer several questions. Number 1, what has happened? Number 2, what's currently happening? Number 3, what is likely to happen? And number 4, what are we doing or what are we going to do? Before I do that, I want to provide you with a little bit of context to at least kind of get us on the same page. If you look at the information that's available with regard to COVID-19, at one end of the extreme, you have information that is highly scientific, coming from very credible sources. And at the other end of the spectrum, you have a variety of postures, including a number of conspiracy theorists. Now, if we were to plot each one of us on this continuum, we're probably at various places along this continuum in terms of our personal beliefs. And the questions that we're asking based upon those beliefs are, is this real? Is it going to be as bad as they say? Is it going to mushroom like they say? Is this really the event that it's being made out to? It is what it is today. In other words, these are real cases. We're approaching 250,000 cases worldwide. We just crested 10,000 cases in the United States. Today was the first day that China reported no new cases, and that's, if my math is correct, 4 months into the spread of this disease. So I'm operating from more of the scientific, the data-driven side of this equation. The other thing that I believe that's important to frame out today's discussion is this idea that once you have landed on a belief and kind of planted your own personal flag in that belief, you'll spend the rest of your life gathering evidence that you're right. What do I mean by that? Well, I have an associate. I told you a story back in October of an associate of mine, a friend of mine, who believes the earth is flat. And I mean, he believes this with all of his heart and soul. And he spends virtually every day of his life just looking at and accepting inputs that support his belief. I believe the earth is round. And I tend to automatically discount arguments made for a flat earth. That's a bias, and we all have them. We all need to guard against those biases as we approach this coronavirus. And we need to be careful not to just accept the things that are being told to us just because they're being told to us. One of the things that we all have to take responsibility for is to do your own research. Now tonight I'm going to share with you several pieces of resource material. I'm actually going to, I've printed them, I'm scanning them, and I'm going to email them to you, but it's not the extent of your own personal education. You need to take responsibility for that. You need to be finding credible sources that continue to feed you with information that's valid and will help keep you safe. So with all that, to kind of start with, let's start with just kind of a general status of where we are today. As of today, March the 19th, we are still sitting with only one confirmed positive case here in Wichita Falls. There are approximately 20 other cases that are what are called PUIs. These are persons under investigation. These are folks who are somewhere in that continuum of some symptoms that appear to mimic those of coronavirus that are waiting through the process of being tested. As you may or may not know, the CDC has put out recommendations that there's a process that patients have to go through before they're allowed to be tested for the coronavirus. The one positive case that we have here in Wichita Falls being referred to as a travel-related case, and that term, travel-related, is separate and apart from community spread. These are two terms that you need to understand. Travel-related is someone who is presumed to have picked up the virus in a foreign country, brought it in with him, as opposed to getting it from someone else in the community. We do not have any confirmed cases of community spread virus. We also believe that the individual who flew in landed in Dallas. We believe that this individual got into a car by themselves and drove home to Wichita Falls. They self-isolated according to CDC guidelines, and when they began to develop symptoms, they first telephoned their doctor's office so the doctor's office could make provision to see this patient, test this patient without exposing any of the doctor's staff to the patient. The patient is back in their home, recovering, and is on the road to recovery, as is so many individuals around the country. We believe, based on the statistics, that most will experience these flu-like symptoms plus some breathing difficulties, but are recovering. The older age adults, 65 and older, particularly those with smoking history or previous respiratory history, are not doing as well. That seems to be the age group and the profile of the individuals where this virus is taking its biggest toll. The individual that's at home, again, is presumed to be, is reported to be getting better, is still isolated, so is doing nothing that would run the risk of becoming a community spread. Now, what has happened? Well, there's certainly been a lot of meetings over the past many business days and weeks to discuss the impacts to the city, and we're all trying to navigate our way through various restrictions like restaurants and gatherings, etc. And I'll give you some more on that in a few minutes in terms of some things that happened today. Up until literally just a few hours ago, each city in the state of Texas was left to navigate this risk management and protective measures on their own, meaning that they could basically do what they wanted. Some cities were at gatherings that were already limited to 10. Some, like Wichita Falls, were at 50. Others were at 250, and we know of at least one city that still had no limit on those types of restrictions. What changed, however, is within the last 12 to 24 hours, the president has stepped in with states who did not initially follow the federal recommended guidelines and has now tied any FEMA reimbursement to the state's compliance with federal guidelines. And that's why if you watch today, you saw the governor of Texas, and if you're out looking about the web, you will see governors in other states who had not yet followed the federal guidelines, putting in place restrictions that are consistent with those guidelines that were produced by the federal government. And this led the governor of Texas, as well as these other governors, to put statewide declarations that impacted protective measures in schools, restaurants, clubs, and gatherings. At 4 o'clock this afternoon, the Wichita County judge and the mayor of Wichita Falls held a joint press conference, and they announced a number of restrictions that in essence mirrored the state's declared state of emergency measures. And these include limiting gatherings to 10 or less indoors. Any indoor gathering had to be 10 or less. It restricts restaurants to either close or they can remain open so long as they provide takeout, delivery, or drive-through service. In other words, there's no in-restaurant dining effective tomorrow, Friday night at midnight. Places that included entertainment like bowling alleys, theaters, also gymnasiums, bars, places that were gathering places were also that are impacted by this 10-person limit. Many of those are just simply closed. And we will have, and we'll send out to you a complete copy of both the press release that went out just a little while ago, as well as a copy of the declaration for the city of Wichita Falls and the county. So you'll have those in the email still this evening. What's currently happening is that this coordination between city and county officials continues, and many other stakeholders. Collectively, I've attended 8 meetings in the last 2 days, all focused around our preparedness, our response, and recovery efforts associated with the virus, trying to navigate our way through this ever-changing environment, an environment that in many ways, up until a few weeks ago, we weren't completely clear on how it is that we would navigate our way through the issues that we were about to confront. We are setting up financial systems and processes for beginning to track expenses. It would appear that this thing is going to have a significant financial impact on us. It would appear that because of the federal and now state declaration of emergency that it's eligible for reimbursement, but it means we have to have systems in place to be able to track those expenses. So expenses that are related directly to this virus that we would not have incurred had it not been for the virus are expenses that we'll begin to track so that the city has the best opportunity possible to get reimbursed for those. We are having daily briefings in an attempt to keep up with this blizzard of ever-changing documents, laws, and recommendations that are coming at us. And it's CDC, it's federal law, it's state mandates. There's a variety of sources that cities are having to navigate their way through. It's more than likely that by the time I get through with these videos and package up these documents for you tonight, something that I've said or something that I've sent out is going to be wrong, or it's going to be updated by the time we all come back to work tomorrow. One example was HR and legal and the city manager's office had already prepared to modify our internal leave policy to account for the additional burden that taking care of a loved one or being out sick yourself might cause. But just as they're wrapping up that effort, which was a relatively monumental effort in and of itself, federal government passed HR 6201, which is called the Emergency Sick Leave Act. It was passed yesterday and became law immediately. That changes the way in which communities like ours deal with the Family Medical Leave Act. And as you probably read from Christy Klein earlier this evening, we're going to see an updated policy and some clarification around how that will work. That'll come directly from City Hall tomorrow. So these types of changes, although we have been planning for a potential change in our policy for some time, a change like a new federal law requires us to, in essence, start over or at least reinterpret or interpret this new federal law and then codify it within our policies and get it distributed. I believe that city leadership is doing all that it can as fast as it can in order to get out ahead of this. But up until the state declaration, we were left with trying to figure out what was right for Wichita Falls. Should we proactively move from 50 to 10 before other jurisdictions were doing that? Should we do something with our restaurants and our bars and our entertainment facilities? These were all questions that were left up to us. And as each step of this process unfolds, in some ways we got to relook at our posture. Now with the state, county, and city declaration now all being almost identical, I believe the process going forward will be a little bit smoother. And the effort around those declarations is to try to definitively close off the possibility of community spread of the virus getting to Wichita Falls. So the next question is, what's likely to happen? Well, right now it's virtually anyone's guess. Even the CDC, a document that I'll send out to you tonight, the CDC says it's not exactly sure how this thing is spread. And so we have to be prepared for the statistic possibility or likelihood that we're going to have additional cases. We don't know that for certain. We don't believe that. We don't have some information that we're not sharing with the public. Just statistically speaking, it's likely we'll have another case. It's possible we could have both a travel and a community spread case, and each of those would walk us down a different path. We're hoping that the controls that we've put in place will prevent that, or as you hear people talking around the country, at least flatten the curve. What that means is instead of having a big spike in the number of cases, that the curve gets flattened so that you have, if you're going to have more cases, you have a slower growth and a smaller number of cases. And in part, that's important because of the overall healthcare system and not overrunning what we have for resources. Clearly, in terms of what's likely to happen, you know, the social impacts of schools being closed, the need for child care, along with the potential economic impact of closing some or restricting other businesses, means we've got a long road ahead of us. There's a lot of work that's left to be done, and this may be a process that unfolds for the next 4 or 5 months before we can look back and say that it's behind us. So what I'm going to do is I'm going to stop this video, and I'll start a second one after I have a little break.